Okay, everyone, welcome to Alcohol Trends Training. I'm Jen Stolka, Director of Prevention at Helping Services. You get me today instead of Sam Howell, our mentoring coordinator. She's home with a sick kiddo, so just wanted to make sure we still could offer the training for people that signed up. So welcome. So today's presentation is being recorded. You would have got that message. Feel free to use your video if you wish. Mute yourself, except when you want to share something, definitely unmute or raise your hand and we will definitely answer any questions that we can. Informal presentation, so feel free to do that at any time. You don't have to wait till the end. And then Sam and Kathy's contact information will be shared later in the slides if you have any further questions or comments that you want to connect with them on. I'm going to turn it over to Kathy for a bit to talk about youth mentoring.
Hey, I had to figure out how to unmute and get my video on. So yeah, youth mentoring at Helping Services has expanded, and I don't know if everyone knows that, but we still serve Allamakee, Howard, Winneshiek counties with both community-based and school-based. And we have expanded as of January 1st, started doing work in Clayton County with Jen Rose being there, and then Southern Fayette, Sam Howell covering that as well. And so Sam does Delaware County and has done that for, I think, 3 years now. And youth mentoring is very simple. It's about being a friend to a youth. Our age of children is from 6 to 17, and that's a little bit different than perhaps you may have heard before. We expanded that a little bit more to help serve the older youth that want to continue. And we offer that positive adult role model for youth to spend time with 4 hours a month. And we have several options available in different counties with school-based, community-based, mentor for a day, families, couples, single folks. Like it says on the screen, the perfect fit. You want to help out, be part of the community, and make a difference to a youth, contact us because mentors are always needed. So that's our commercial.
That's good. Thanks, Kathy.
Yep.
So today's agenda, we're going to look at Iowa's and national use rates. We'll take a peek at youth use rates as well as our laws and some statistics and how we can help as whether we're professionals or mentors with talking with our youth. And of course, at the end, we'll have evaluations, questions, and comments. But like I mentioned, if you have anything to add on any given slide, please feel free to just chime in. Okay, so taking a look at Iowa right off the bat. Iowa consistently is above our national average for binge drinking episodes. The national average is 22.6%, and Iowa comes in at 29%. And that's been consistent like that for many, many years. We seem to top the national rates. We're experiencing more harm related to excessive drinking than other states, whether it's an increase in liver disease, related deaths or car crashes, loss of time, suicide, and alcohol impaired driving. So a lot of areas were coming out ahead of national rates. Abusing the alcohol rate at 20%, and this is for adults. And that looks at going beyond just the drinker. Obviously, alcohol use disorder definitely plays into the family and friends and the work environment. So it's a whole circle of people who are being affected by use rates. Iowans are drinking excessively to the point of $1.9 billion a year. And this is through the CDC statistics. This includes loss of productivity, health-related costs, juvenile court costs, or criminal court costs, motor vehicle crashes, property damage. So the whole list of things play into coming up with this number. But that's a lot of money, people, that alcohol and excessive drinking can bring to a community. So we're seeing alcohol-related deaths at a huge increase than in the past decade. So to the point where the Iowa Department of Public Health, or IHHS, I guess, Health and Human Services, has put a lot of focus, on this area. So it's all very concerning that Iowa still is at these rates. Taking a look at binge drinking, and this is age 18 years or older, when we're looking at past 30-day use. This comes from our Berkus survey. The state with the highest percent is Kentucky, with a 9.5 rate, and then Iowa ties with Hawaii at a 9.1 rate. So we're right up there in the 75% percentile for binge drinking rates. So taking a look at this map, you see kind of where we fall. The Midwest plays into that a little bit. So that's just giving you a look at where we fall for binge drinking rates. This is taking a quick peek at our Iowa Youth Survey, and for those who maybe don't know, I think maybe just one or two. This is a survey that is offered to schools every 2 years. It's voluntary, so they don't have to take it. As you'll see, this is our service area minus Howard County. They chose not to take the 2021 Iowa Youth Survey. So we don't have those numbers on here, but this is a look at our mentoring service area compared to the state. And what this looks at is the past 30-day use. So looking at the blue, this is, have you had at least one drink in the last 30 days? And this is how our youth have answered. And if you compare it to the state rate over on the right-hand column, that kind of gives you the gauge that we use. We often compare everything to whether we're higher or lower than the state rate. So if you look at the red or the pink maybe on your screen, that's past 30-day use of having 5 or more drinks at one occasion or one setting. So looking at people who've had at least one drink compared to who are binge drinking, it's good to see that we definitely have lower rates for that. And then looking at the green and purple, the green is if they're drinking beer, and the purple is if it's some sort of other alcohol. So they just started to measure that not too long ago to do this specific comparison. And as you can see, the purple, which is somewhat alarming, not that it all isn't, but that our youth are choosing to drink some other form of alcohol than beer. So we'll definitely keep a pulse on that, and definitely talk to our youth about what that is looking like for alcohol trends. And we'll get to a couple of those trends here in a minute. This is looking at the age of first use. We always try to keep up with when, where should our education be placed? Where should we be starting to educate kids? And as you can see, it's pretty young, right? Looking at these numbers, again, we compare to the state rate. So on this chart, the orange is the state. So if you want to compare all the other bars to the orange, that's what we're looking at. But as you can see, 8 years and younger, overall average of all our counties, we're at a lower rate than the state. Same thing with our 9 and 10-year-olds. Our 11 and 12-year-olds were right at that state rate, about 24%. So we're sitting there. For 13 and 14-year-olds, we're at a higher rate. So this is in Iowa, this is where we're seeing, or in our service area, this is where we're seeing kids start to increase or have their first use at about that 13 to 14. And then as you can see, once they kind of hit high school, the 15, 16-year-old, our rates increase drastically. Even though we're at a little per average lower than the state rate, you can see that 17 on up, that's usually the shocker, because there you can see that if they've had a drink, they've already had it before they're a junior or a senior. So we take this statistic in this chart and say, this is where we need to start our education at a much younger age. You know, we used to not even think of elementary school, but as you can see, our numbers maybe are putting us down to that level. At some level, every education component is a little different and needs to be tailored to an age group. But as you can see, that can be alarming when you're thinking of 8-year-olds experimenting. Okay, here's a myth held by many parents. My child is not interested in drinking. When really 90% of students try alcohol outside of the home before high school graduation. So we need to really work on educating our parents and people who work with youth on kind of having that mentality that, oh, it's not my child, or they're not interested. We need to really have a pulse on what's happening amongst our youth so that we can be helpful resources and help them or guide them at least in providing the right education so that they can make a healthy choice. Think to yourself when you first tried alcohol, and did you know your parents' rule on alcohol consumption? And if anyone is brave enough that they want to share, or if you want to just share the rule, you can do that too. But does anyone want to come off mute and share, since we're kind of a small group?
I will share.
Thanks, Mackenzie.
My mom was really strict about not drinking at all, but that just made me a little sneakier. Definitely, I think my first time was probably 16, maybe even 15. But yeah, my mom was very against it and she was very naive. And I told her now that I am adult and legally able to drink that I did that, and she was completely shocked.
Oh, interesting. So she really didn't, yeah.
Yeah, she had no idea.
No idea. You know, because some I think would say like they knew, but they didn't want to know. So they, yeah. Anybody else want to share? I'll share mine. I was 14 because I hung out in for those who know me, I'm from a very small town. And I hung out with 16-year-olds at the time, you know, so because that's who was in my town. So I did what 16-year-olds did, right? And our rule was absolutely no drinking, except my dad and stepmother drank. And so it was kind of a double-edged sword. And I was a little bit of a rebellion and said, well, if you're going to do it, I'm going to do it, type of thing. So it was zero, you can't drink, but no sort of education along with that, or that went along with their drinking or their role modeling to what, you know, I did. So
Jen, just a couple things in the chat. Someone shared no rules were given in our family. The father didn't mind and would actually offer. And also someone has their hand raised, and if you can unmute, that would be great.
Hey, Jen, it's Stacy.
Hey, Stacy.
So just to kind of share my story, I was 14 years old. I was at a softball tournament in Hawkeye. Some of my parents' friends were like, hey, drink, this will be so much fun. And they were grown men that really had no business drinking with me, but they got me drunk. My parents let me hang out with them. I got dropped off late at night, and the next morning was the first day of my freshman year of high school. So just no rules, kind of accepted behaviors at ball tournament. And thank God these guys were safe for me to be with. But I always think of how different that could have been if I wasn't with some people that respected boundaries, and yeah, kind of scary stuff.
Yeah, especially as an adult, knowing what you know in the
Yeah,
field.
for sure.
Yeah. Yep, exactly. Thanks for sharing. So over on the left-hand side of your screen is a campaign that we often use in prevention, the Talk They Hear You campaign. And it's really geared to parents to give them just those little talking points, or because I think parents are sometimes afraid to talk about it, or they don't know what to say, or they don't even know where to start. And there's always the belief that like, oh, if I bring it up, then I'm going to put the idea in their head if they already aren't, or you're not, because we know that kids are already way smarter than us. So But this is just a nice handout about the 7 warning signs of underage drinking that a parent or someone who works with youth can kind of gauge. Obviously not one of these things means they have alcohol use disorder or anything like that, but it's the compilation of things that might be happening that can be a red flag for you. Whether it's mood changes, and this also could be typical teenage behavior. So you really do have to do some sort of a comparison and what's maybe off. So mood changes, all of a sudden maybe problems in school, being a rebel if they normally weren't, change of friends, that's usually a big red flag for some people. Nothing matters attitude, and that's if they used to not have that kind of attitude, or they stop caring, or they don't care what their appearance looks like, or those all can be red flags for people. Alcohol presence, obviously, if you find products, and that's why we always encourage you to attend our hidden in plain sight events, because that event gives you a look at what could be an alcohol beverage versus something you think isn't. And we'll get to a slide that shows that in a little bit too. And then physical or mental problems that weren't maybe already there. So just a things for your toolbox that you can look at if you are working with a youth or have a child that maybe is going to present some of these things as a sign of alcohol use. Okay, so let's jump into some of these trends. I think I say this right, Borgs, am I saying that right? Blackout rage gallons. So these are a popular trend right now. It's a mixed drink or a mixed compilation of things in a gallon jug. It contains water, alcohol, flavoring, and unfortunately is known as.
Oh, my God.
Sorry,
Sorry.
that's okay. Did you have something, Cassandra?
No, my dog was biting something he wasn't
Oh,
supposed
sorry.
to. Sorry.
That's okay. It's known as no hangovers or a hangover remedy. The drink became popular via TikTok. And for Gen Z individuals in about 2022. So it's a way to just have all your drinks in one container and away you go type of thing. So super concerned for this type of drinking, because obviously that's a lot, and I'm sure there's not proper measurements. It can be mixed however an individual would like. And oftentimes they make it fun by putting, a name on it or a nickname, that type of thing. So that's a concern of ours. That's kind of a new trend. Definitely didn't do this back in our day. So something, once you hear that, it's called the blackout rage gallon, Forbes. The next idea is this sober curious idea. Sober curious is for customers, as they say, that are interested in finding a no alcohol, low alcohol beverage type of lifestyle. So very trendy right now in the idea that it's a way for them to put out a term that says, you know what, I want to take care of my body. I don't want to, I want a healthier choice. So I'm in this sober, curious culture that they're considering their well-being, their mental health, that sort of thing. And they use what's called functional drinks during this, and this is usually THC or CBD infused products. So these products have no alcohol in them. They can be as simple as being a water that's infused with THC or CBD or CBD. And the idea is that it's a safer alternative to getting drunk. So the idea is that there's no hangovers again. It puts you in a relaxed mood. It helps you relieve stress still, but it is THC infused, so it's more of, you're getting the high still, versus, getting drunk, so to speak. So we've had some presentations that have included climbing kites. They're kind of a popular one right now. These elements are another one that they specifically focus on whether you need sleep or if you need to focus on things. So the market is really attaching to this sober curious idea and really trying to profit off of people in the sense of, don't drink alcohol. That's bad for you. And we know that can get you into trouble and that sort of thing. Here's a way to stay abstinent from alcohol by having this more mindful, more healthy choice of these other products. So I don't know how young, they're all kind of new. I'm sure our high schoolers are getting their hands on them. Definitely college level or age kids are definitely exploring these, as well as other adults. There's a couple bars in Cedar Rapids, Iowa City that are offering these products instead of alcohol. They still have the alcohol, but it's still an alternative that they're offering. Sam did some research or I think Mackenzie and Cassandra maybe seen them in their fairways already. Definitely gas stations across our service area have them available. So, and the scary part is they look like some other products. So very much geared towards a youth population and also to be sneaky. So like I said in a previous slide, a parent or someone who works with youth, they have to sometimes know what they're looking for, because all of these products on this screen are a representation of something else, right? So up in your right-hand corner is Mountain Dew. So, but these are not just Mountain Dew, or whether they're using lemonade or a tea or Sunny D. They all have some other form of alcohol with them. So very, very trendy. The sneakiness, is good marketing to them because it's working. People are able to disguise what they're drinking too. So any questions on any of that? It's kind of a lot of trends right there. Or anything I missed, prevention people, that you want to add?
Not a question, but just on the Borgs again, those are really common, especially when kids get to college. They throw darties, which is basically like a day party outdoors. And those are so common. I feel, I know in Madison, they do it a lot where they'll do like street-wide parties and almost every kid will have one of those, even if they're not of age. But yeah, very common.
Wow. Yeah. Gotcha. Thanks for sharing that. Yeah. Anybody
Jen,
else?
I'll also, can you hear me?
Yep.
Okay. I'll say that in college was my senior year. We actually did like a board party because it was just coming up on TikTok. And yeah, I mean, people would put literally a whole handle of vodka or whatever liquor, and you can mask it with like a Mio and things like that. So, and it would taste like juice. So definitely concerning of how people can, all that alcohol and it just tastes, good. So
Yeah. Yeah, and like you said, Ellie, that's the scary part too. Like kids are thinking they can handle it, or where's that leading some of our youth who can't tolerate that much alcohol so that's super scary. Super scary. So thanks for sharing your guys' insight and further knowledge. I appreciate that. Okay. Some beliefs that we are trying to debunk as far as making sure that kids just have some of the facts that, the myths that have been put out, black coffee will help you become sober when really it just makes you a hyper drunk, so to speak. Exercise would help you become sober. Eating food can help you, although it could put you on a process and get something else in your stomach. It's not gonna just all of a sudden change your blood alcohol level, right? Taking a cold shower, you'll be a more alert drunk, so that's okay too. And I probably shouldn't use that word drunk, but fresh air, same thing. These are all not gonna hurt anything, but it's not going to change your blood alcohol level at that point. Nothing but time changes that. So we have to make sure our kids are knowing that, oh, I can go and drink a lot and I'll just sober up real quick if I do these few things. So going from dark lighting to bright lighting, you can become sober. Drinking milk before drinking will allow you. That just makes my stomach hurt thinking about that. Putting a penny in your mouth. Raise some hands. How many people maybe did this? Put the penny in your mouth. Yeah, it doesn't sober you up. It just puts a really bad taste in your mouth. And I think people used to think like, oh, if you got pulled over, then the cops couldn't smell the alcohol in your breath. It takes away the smell. So, and this is all from a parent handbook for talking with college students about alcohol. So just some of those beliefs that we've gathered over the years that we want to make sure youth have the knowledge that there's no quick sobering up, so to speak. So putting that out there. Fact or fiction, it's illegal for someone under 21 to be in a licensed establishment that sells beer, wine, or spirits. You can put it in the chat if you want, or you can just holler it up if you want. What do we got, Kathy?
We're getting fact, no, false, false, fiction,
Yeah.
and false.
Yeah. So most establishments, no, there is not a law. Some cities put ordinances in place, like some of your college towns, you have to be 21 to get into establishments. Some places choose to put their own time limits on things. But most of our places, especially in rural Iowa, there's no limit on someone under 21 being in their establishment. A lot of those places have food and people eat there. Some places I've heard, after 10 o'clock, you have to be older to be in there, but it's not illegal across the board. I just saw a tweet in Ohio. There is a bar that's been having tons of fights. And so they just raised their limit to 30 years old because they want to get rid of the violence in their bar, and they want a bar that's just going to be a chill place for an older population to go. So, so I thought that was interesting. I just read that today. So, the criminal penalties for sales to minors. So if a minor is in a bar, it is against the law, obviously, for any licensee to sell, give, or otherwise provide alcohol to someone under the legal age. The first fine is $1,925 when it's committed by the licensee, and $645 if it's committed, or if, like a bartender or a clerk sells to someone under 21. So it's a big deal. It's a big deal to keep that access and keep alcohol out of the hands of our youth. Good job. Oops. Okay, and then looking at the latest Iowa trending law is, unfortunately, the state of Iowa has lessened regulations on who can actually serve open containers. So Iowa, just as July 2023, passed a law that allows 16-year-olds in an on-premise licensee to serve alcohol. It used to be 18 that you had to be in order to even take a drink to a table at a restaurant. And now Iowa has passed the law to allow a 16-year-old to do that. So, and the sad thing with all of that is, one, it's just youth exposure to it. It's funny that the law actually reads, there's supposed to be 18 plus, at least 2 18 or older individuals in sight of it all, so they should be supervising it. And any 16-year-old has to have parent permission, and they have to go through a sexual harassment training. So I just shake my head, I think all prevention people do, at the idea that if we have to have our youth go through a sexual harassment training in order to be a waitress or a waiter, that's pretty concerning. So this is a new Iowa law, and it's 10 steps backwards from where we actually want to be. Does anyone have any questions on that? Probably not, because majority of your prevention people.
Jen, do they also have to do a prevention training as well?
No.
Hmm.
They have to have parent permission, the sexual assault training. They don't have to do any sort of tips or compliance. Because that's not, they didn't write that in, right? I mean, any establishment doesn't have to do a responsible beverage server training. Unless a city or some place has put some sort of mandate on it, but.
And that's because the Iowa Restaurant Association, who was behind this bill, they offer Serve Safe, and they want their members to take it with them. So it wasn't required anywhere else.
Sure. And Serve Safe, they don't have to stay, so they do.
They do not have to. It's just a kindly suggestion to take it from the Iowa Restaurant Association.
Sure. Yeah. Yeah, that should be another, at least written into the law that they have to, right? Because you're exposing youth to a whole new level of liability and just again, access and exposure. So. Okay. My slides don't want anything else. There we go. This is specific to Delaware County, but this was just a quick look that Sam had thrown in hers. I don't think we have any, well, I don't know if Crystal ever joined. Delaware County people on here. This is just underage, under 18, of what our alcohol related incidents have tallied up to be. So, and we, law enforcement will tell you, oh, there's less parties. Youth tell us that too, less big parties. There's still small gatherings. There's also less focus. They're kind of sometimes dealing with other things. Youth are staying put, that sort of thing, but it's just a quick look, sorry, for most students. Now I'm going to turn it over to our great colleagues from ASAC. We have Mackenzie and Cassandra from there. Thanks, ladies, for joining us, and I'll let you guys take over.
Thank you for including us in this presentation. I'll start off. So I'm Mackenzie. I'm a prevention specialist with ASAC in Delaware and Dubuque counties. I'm partnered today with Cassandra, who is the manager for Delaware and Dubuque counties, but I'll let her introduce herself when she hops on later. So just a brief overview of ASAC. We have 3 categories that we kind of offer: prevention, treatment, and recovery. A little bit about prevention, which is where Cassandra and I work. We focus mainly on education and awareness in our communities. That's through providing trainings, youth programs, just anything that you can think of to provide education. The more aware that our community is about things going on in the community, we feel the better that people are able to make healthy choices based on what's going on in our community. We also offer treatment, which is very unique to each individual. So treatment can include one-on-one counseling with our counselors. It can also include group sessions that we offer through ASAC throughout the week at varying times. These group sessions can vary based on age, gender, any substance use that they're experiencing. It can be individual, it can be family, group sessions when needed. We also offer recovery, which again is very unique to each individual, and usually our counselors will be very, what's the word I'm looking for? Very, they will kind of decide on how that recovery process looks for each individual, and it will be based on what the individual needs and some of their support that they have around them, including family. And then I will pass it off to Cassandra to kind of talk about some of the youth options that we offer just for education in Delaware County.
Hello, everyone. So Mac kind of gave you guys an overview of what ASAC is. And then my name is Cassandra Caceres. I am the Prevention Specialist Manager for Dubuque and Delaware counties. I work again in prevention. So we offer a variety of educational programs to the youth, but the ones that we wanted to highlight today were Generation RX. And Generation RX is a program that talks about prescription pill safety for youth. It comes in 3 different levels. You have elementary level, where the language is geared towards the younger kids. You have elementary level, and then you have high school aged group where the information is geared towards that age range as well. The goal of that is to raise public awareness about prescription drug misuse through toolkits, resources, and training. So we do a lot of different things with youth that decide to go through that program. The next one we have is called Substances of Abuse 101. So that training is specific to our state opioid response grant. And that one just allows us to talk about the different substances in the area, as well as short-term and long-term effects if someone were to use these substances. And then it can either lead into stigma associated with substance use disorder, or we have just a large list of trainings we offer on top of that. But we feel that one is very important for people to understand in general. And then the last one is Prime for Life. And it's Prime for Life 420, which is marijuana specific, but it covers both marijuana and alcohol. All of the programs that we share are evidence-based programs, so they're backed up by years and years of research. And it shares, again, the long-term, short-term effects. Some examples that it talks about could be muddy thinking, increase in tolerance as people are using substances or engaging in high-risk choices of alcohol use. And it's basically an activity book that we give these kids where they follow through the material with us, and then there are different activities that they follow to kind of just understand the material a bit more. And I don't know if Mackenzie, you want to add any more to that?
You kind of covered a lot. I guess these programs mostly are just geared to teaching children how problems can come about and trying to avoid those problems with substances. So again, just education is our biggest goal in prevention. The more these kids are educated on it, the better choices that they can make in regards to some of these substances, including alcohol. The Prime for Life also covers serving sizes, which I don't ever recall learning in depth in school. And as an adult, I didn't know what low risk guidelines for drinking are, and the program does go in depth with that. So when these kids do become of age and they are around legal alcohol consumption, they know kind of how to make smart choices in regards to the alcohol use. So I think that's all that we have for ASAC, but again, I want to thank you all for being here and inviting us for this presentation.
Great, thank you. Yes, keep up the great work. You guys do a great job. So thanks for being here with us too. Does anyone have any questions for Mackenzie or Cassandra on their services or prevention related? You did a good job. Okay, so moving on. Let's slides just don't want to advance. Oh, there we go. Okay. So what can we do about this, right? Or what can we do as an individual to help others? Obviously, everyone on here, especially even our mentor, Your Life Iowa. That's our go-to. It has all the resources that we need, everything from screenings to referrals to just providing, giving ourselves that education that we might need. It's always a great resource to utilize. Talk to those who you care about. If you have any concerns about what's maybe changed or habits, or even if that pre-talk to them being exposed to alcohol is important, to start having those conversations and to see what they know or where they at, or what's their thinking? Do they know your expectations or your rules? All those need to come into play as remember back to the 8 and younger slide. It needs to be at a pretty young age. And there's different levels. You don't have to get in depth with littles, but you can definitely start having conversations. Know what your mental health and treatment resources are. So if you do need to reach out, you have that in your toolbox. So for our service area, obviously ASAC is our go-to person up here in Northeast Iowa, is Northeast Iowa Behavioral Health. So we have services available. So having those in your knowledge bank, then you're good to go there. And we want to celebrate and model healthy coping skills. So many adults maybe don't realize that youth really are watching, right? And so our behavior sets the culture, sets the tone for how our youth are going to act, respond, etc. So if they see that it's normal behavior for alcohol use to be that stress reliever or that coping strategy, then they think that's an okay behavior to turn to, versus finding a healthy way to address their stress or their coping, or having a healthy coping style. Okay. This is just, no, oh, go ahead.
Jen, there's just a quick note in
Yeah.
the chat. Someone shared, I spoke with our foster child about alcohol, and they shared that they think they were 4 years old when their father gave them alcohol.
Yeah, I'm sorry that happened. Right, so it is that lack of knowledge, the lack of knowing the dangers that can spur, but again, that maybe was a culture that individual was also raised in. So we can, as adults in children's lives, we have to do our best at making sure we are having those conversations on what's healthy, what's not healthy, what your expectations are. And this kind of gives that framework too on this slide, keeping it simple for them. That situation, all of us probably have some choice words for that, Dad, but we need to turn that table for this youngster to make sure that he or she's making healthy choices from now on, right? It's okay for you to share your emotions on it. Like it makes me nervous, or it makes me scared that all these different kinds of drinks are available to our youth, right? And I want you to be healthy and make healthy choices. Reiterate the truths. Always putting out consequences or the harms is an okay strategy too. Scare tactics usually don't work for kids. I think Mackenzie was a good, like, yeah, you can tell me that, but I'm still going to do what I want to do. But we just have to give them the education, and our youth have told us over the years too, don't come to us and preach and tell us don't do drugs, type of thing. Give us the education, we'll make a decision, and that's that. So that's what really a shift in prevention has happened since my 15 years in prevention. We really just try to get away from the don't do drugs and that type of thing, or the scare tactics, or to more of the education, awareness, healthy choices mentality. So make sure you're having follow-up conversations or asking anytime there's a teachable moment, utilize that. And always put it out there that I'm here if you ever need to talk. So leaving that door open for them to be able to come to you and trust that, you know, maybe you're not gonna freak out at them, or, you know, because everyone's human, everyone makes mistakes. No one's perfect in all their choices, so we have to be that good role model as well as being a guiding source for people. So what else can you do? You can join your local substance use prevention coalition. If you're in our service area, there's one in every county. So we'd love for new voices and new ideas to come to the table. That's always welcomed. Advocate ways to help youth with healthier coping mechanisms. We kind of touched on that already. Educate our lawmakers. Obviously, we want to reduce any sort of access or exposure to our youth. And with this new law, we definitely took steps backwards. Stacy's our guru on policy and lawmakers, bless her heart. So if you ever have any questions on that, I will probably refer you to her. And know your resources. Like I said, know who your treatment and mental health, obviously know who your prevention or your coalition people are, because we have tons of resources we can give you or help you with talking points or whatever you might need in having those conversations. So, and just even knowing you're like Iowa's there, us prevention people are turning to that all the time too. So it's good to know. So if a situation does come up, it helps say, okay, we can deal with this, we can handle this, here's our resources that we have. Okay. We like to get people to do the evaluation while we have you. So before we wrap up today's meeting, if you guys want to use the QR code, otherwise Kathy will put a link in the chat. And if you want to just take a few minutes and do a quick evaluation for us, we truly appreciate any input and feedback that you would have.
Jen, I don't have the evaluation link. I'm sorry.
Okay. It's a small group, I can send it out too, but I think most people.
Jen, I'm on my phone. Is it possible for you to send it to me, please?
Yes, yep.
Thanks.
Yep. Okay, does anyone have any questions that you would want to throw out, why people are kind of doing their evals, or any further input or advice or thoughts or experiences? Sam and Kathy, as our mentoring coordinators, are available for any further questions that you have or resources that you're seeking. Same with Mackenzie and Cassandra. They're always available and are a great partner of ours that can help us find answers, or you know, they go further than our prevention world at helping services as far as recovery and treatment. So nice partnership that we have there. So
I do, Jen, I do have a question just as a prevention person. There were some
Yeah.
young people with college experiences that were seeking. I'm kind of curious, what, if any, messaging they think would resonate with high school students or young adults, college students. Obviously, it's a time where we try all the risky behaviors, but what could their parents have said or done or encouraged to make them think differently about trying?
Yeah, great question. Ellie, Cassandra, Mackenzie?
Yeah, I have a comment for that one.
Mhm.
I would say honestly thinking about long-term effects, because a lot of the times with risky behaviors or risky choices that people are making, they're only thinking of that present moment. They're not really thinking about how it'll affect them in the long run. So I know there's a lot of media out there now, with an example being vapes, and how vapes can affect kids who are like in their 20s that have maybe started using in high school. So I feel like that's something that would benefit youth. Because that's something I always thought about when I was in college. Vapes were super popular. And I always thought about, okay, well, if vapes are being promoted in the media by these larger cigarette companies, how good can it truly be? So that's just from my perspective. And I think Mac wanted to say something.
Yeah.
Yes, I also agree with Cassandra. Definitely think about the long-term effects, but also talk to the kids kind of like they're adults. I know that sounds weird and you want to coddle them and kind of shelter them from the world. Talk to them like they're real people. We were all young once, we were all curious. Don't make it seem like you never did anything wrong. I definitely think being more relatable helps kids understand you a little bit better.
Did that help, Stace, with anything?
Yes, thank you so much.
Yeah. I could do a focus group with Grant and his friends too, if you want me to. I might get a dumb mom, but.
Sorry, I was trying to unmute. I think that's a great idea.
Do you?
He would be mortified, but oh
You
well.
would be, yes. Yeah. Great. Anybody else? Okay, well, I'll give you 5 minutes back of your day then. So thank you all for joining us. We appreciate it. Thanks again to Mackenzie and Cassandra for being my co-speakers today. We truly appreciate you guys. Thanks to Kathy for being my wing woman. So have a great day, everybody.
Thanks, Jen.